Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuvir Deshpande from Pune, Maharashtra State, India, would like to welcome you all in the Charak Uttaratantra or Charak Uttarardha. It's not Uttaratantra, actually, the proper word is Uttarardha. That means first Charak Purvardha and then Charak Uttarardha. In Charak Uttarardha, as you know, there are basically Chikitsa Sthan, then Kalpasthan, and then Siddhi Sthan. So Siddhi Sthan is nearly the last sthana or the section of Charaka Samhita. Chikitsa Sthan, of course, we are going to study the Chikitsa Sthan because Charakastu Chikitsite. That means Charak Grantha is the most important text or Samhita or the compendium if you want to treat with the principles of Ayurveda. Try to understand. Principles are important which are mentioned in the Charak Samhita. Last few lectures we have studied about the Kalpasthana, which includes the nearly 12 chapters having 6 plants useful for the Vamana karma and 6 plants which are useful for the primarily Virechana karma. Now, this is the Siddhi Sthana. Why the name Siddhi? Why the name Siddhi? The first chapter we are going to see today, Kalpana Siddhi. So, Siddhi is a success. Please write down. Siddhi is a success. Success in what? Ayurvedic treatment success. If we want to treat the patient and get the success in the treatment, then we must know this particular Siddhi Sthana. And after total Chikitsa Sthan, then knowing about the different plants of Vaman Virechana in the Kalpasthan and knowing the indications, contraindications, and complications. Please write down these 3 words. About the Vamana, Virechana, Basti, Raktamokshana, Nasya, Panchakarma. In the last year BMS, you have the separate Panchakarma subject. And this particular your study, Charaka Uttarardha study, Kalpasthan, Siddhisthan, Chikitsasthan, it will be useful in your last year BMS if you study this year very hard. So, because you will be nearly 70% preparation of the Kaya Chikitsa subject and 70% preparation of Panchakarma subject. So, if you try to understand these shlokas, try to remember some shlokas, then you will be benefited definitely in the last year while writing the paper of Panchakarma and Kaya Chikitsa. So, Siddhi is a success. That means in this chapter, basically the Panchakarma, Vamana Virechana, and basically Basti, the indications are given, contraindications are given, and most important, complication. Please write down the word Vyapat for the complication. You have already purchased, or everybody should purchase, own textbook of that particular subject. So you might have been the Marathi, Hindi, English, Charaka Samhita. After my lecture, immediately you open the book and try to make some notes. Now, in this particular PDF, there are some Marathi words or the Devanagari script words are distorted. So, don't go with these particular words because they are bad, distorted because of some technical issues. So, you have to open your textbook afterwards and then write down that particular Devanagari script shlokas. Don't believe on this. Even if you take the screenshot, Marathi words will not be proper at some places. Be careful, be careful. Okay, English matter is okay. English matter is no problem. But whenever you see Devanagari, Sanskrit, Marathi, they are distorted. Okay, let us start. So now the next, your question will be, what is Sir Kalpana? I have understood this. But what is this Kalpana? Kalpana is a Panchakarma. Simple. Vamana, Virechana, they are called as a Kalpana. Now, you know that Panchakarma is for the purification of the body. First, in the beginning, I will give tips. Vaman for basically Kapha Prakopa. Please write down. Basically Kapha and secondarily, primarily Kapha, secondarily Pitta. Vaman is useful for primarily for Kapha and secondarily for Pitta. Please write down. Virechana, purgatives, laxatives from the anal root. Virechana is useful primarily for Pitta, into bracket Rakta also, because Pitta and Rakta Ashraya Ashri Sambandha. Primarily for Pitta, Prakupita Pitta, into bracket Rakta, and secondarily Kapha. So Virechana is for Pitta Kapha. Vaman is for Kapha Pitta. and Basti for Vata dosha, Rakta Mokshana to remove the impure blood, bloodletting, blood donation, and Nasya is for Urdhva Jatrugata Vyadhi. Jatru is a clavicle. This bone, collarbone, clavicle, above. ENT, ear, nose, throat, face, brain, or Nasya, nasal drops. Okay, so we will start. Now, there are two things important. Before any Panchakarma, you have to do Snehana and Svedana. Remember these things. Snehana is oil massage or internal taking of ghee. Internally, orally, ghee. Huh? And second is a Svedana, fermentation. Nadi Sveda. You please visit in your college hospital and try to visit in Panchakarma department by taking proper permission, making the apron, I-cards, etc. But unless and until you visit the Panchakarma department, you will not understand what I am talking about. Next important thing for everybody, Dr. Deshpande has mobile app. The name is Ayurveda Academy. From Google Play Store, it is free download. Free download. Please download it. And there is one interesting program regarding the Panchakarma. Fantastic videos are there. Myself has shown the demonstration how to do the massage to my particular friend. I have massaged him. Personally, I have massaged him. So see all these videos. All the lot of PDF are there in English regarding Vamana, Snehana, Svedana, which oils, Shirodhara, Kayaseka. Everything is given in my mobile program, very, very cheap. A nominal price is there, but you have to purchase that program and go for that, all the knowledge of Panchakarma. Okay. Now, before doing any Panchakarma, we do Snehana and Svedana. First is now I will mark like yesterday, we will start slowly and steadily. No hurry and worry. Okay. Concentrate over here. Abhyantara, distorted. Devanagari, distorted. The word is, please write down in your notebook, Abhyantara. Can you see how bad it is? Abhyantara Snehapanam. Please write down. Abhyantara Snehapan. What does it mean? Internal administration of ghee, ghrita, or oil. Maximum times cow's ghee or medicated ghee, and sometimes sesame oil. Tiracho tel, sesame oil, has to be done for minimum 3 days and maximum 7 days. Snehan is given for 3 days or 5 days or 7 days. 3, 5, 7 number is important. For Mrudu Koshta, sorry, Marathi matter distorted. Mrudu Koshta, 3 days taking ghee sufficient. For Madhyama Koshta, 5 days Snehapana, and for Krura Koshta, hard, Krura Koshta, Vata Koshta, maximum more time of oleation because it is a Ruksha. Vata is a Ruksha. So more days Snehapan is given. In the Snehapan is continued for more than 7 days, it becomes Satmya to the body, and hence this word is distorted. Now, please kindly excuse me all the time. This is Satmya. Satmya to the, that means it is accustomed to the body, and then it will have no therapeutic or cleansing effect. So maximum 7 days. Otherwise, it will be accustomed. Savaicha hoon jata Marathi madhe. It is accepted and then no effect. So benefits of Snehapan. What are the benefits? Anilam Hanti. Control on the Vata dosha. Please write down 2 words. I am saying 3 times. Anila is equal to Vat. Anila is equal to Vat, but Anala is equal to Pitta or Agni. Please write down. Anila Vat. Anila is a synonym of Vat, another name for Vata dosha. Anala is equal to Agni, fire. So don't get confused. Anila and Anala. This is Anila. Okay. So Vata control. Mrudu karoti deyam. Softness will be there. Malanam vinihanti. Use of Sneha normalizes, balances the Vata, softens the body, softening. Mrudu. And removes any obstruction to the excretion of waste. All the channels will be clean. Srotasas will be clean. Smoothness will be there. Okay, let us go further. Slowly and steadily. We will move the screen slowly and steadily. Vamana, Virechana, Purva Ahara. before giving the Vaman or before giving the Virechana. We have to increase the kapha. Very interesting. Sir, it is given to remove the kapha. Yes, my friend. But for removing, you have to make a more stimulation and then kick them out. First, more kapha in the body. It is already there, I know. But with your little bit food, just for one night, you give it, and then all the kapha will come out. Before the day of Vamana, that means previous day, and the food that aggravates the pitta. For the Virechana, pitta. For Vamana, kapha diet should be given. The day before the Vamana, the day before the Virechana. Okay. Once the patient has been subjected to adequate snehana, drinking oral ghee and oil, or Svedana, it is ready for the Vamana procedure. Okay. Now I will move the screen on the right side, please. Just please patience with you, slowly and steadily, so that understanding should be proper. Okay. Now, after Vamana, there are 3 steps, like a surgery. Like a surgery in any operation, preoperative, like giving the atropine, then giving the compost in the night before just to get a good sleep. So ECG done, that is preoperative. Then on the day, hernia operation, appendix operation, cutting abdomen, operative. And then post-operative. You know this, post-operative. That is a dressing and all these things. Similarly, in Panchakarma, 3 steps. Don't forget 3 steps. Purva Karma, write down. Purva Karma, Pradhana Karma, Paschat Karma. In any Panchakarma, any Vaman, Virechana, Basti, Raktamokshanasya, Purva Karma, what is that? What is that? Snehana and Svedana. Pradhana Karma, that is Vaman, Virechana, Basti, and Paschat Karma. Paschat Karma is called as a Sansarjanakrama. Please write down this word, important for SAQ. Sansarjanakrama. That is a diet advice and lifestyle advice. Sansarjanakrama basically related with food. After giving the Vaman, after giving the Virechana, what diet should be taken? Once the patient regain his strength, again after Snehan and Svedana, and as when required, Virechana drug can be administered. That means if after Vamana, it is not done in the practice. Nobody do all the Panchakarmas. Nobody. Some people will be given Vamana, some people will be given Virechana, some people will give Basti. But in the Charaka Samhita, in the text, they have explained what should be the procedure. First Vamana. If anybody wants the Rasayan treatment, then Virechana, then Basti, then Raktamokshan. But nowadays, all the Panchakarmas are not done. Okay. So, Shodhana is of 3 types. When the cleansing is taking place, it can be the best. Pradhana Shuddhi. Oh, okay. Moderate Shuddhi, purification. And Avara Shuddhi, not very much clean, not good. Effect is not good. So Pravara Shuddhi, best Shuddhi, best purification of the body. Madhyama, okay. Avara, bad, no effect. Pravara, Madhyam, Avara, Sanskrit terms. Next. After getting the Pradhana Shuddhi, Madhyama Shuddhi, Avara Shuddhi, Pravara, it is a Pravara Shuddhi. Then you have to give the Manda, Peya, Vilepi and Yusha. Now, forget about this. Little forget, not too much. You have to write down afterwards from your textbook. But interesting, I will tell you. Basically, you write two words. Sansarjanakrama, after Panchakarma, diet advice. Yavagu. 3 times. Yavagu and Yusha. Yavagu and Yusha. Yavagu and Yusha. Yusha. Va-A-V-A, Yavagu, G-U, Yavagu. Yush, Va-U, S-H-A. Okay? Now, below Yavagu, there are 3 types. Please write down. Yavagu, 3 types. Manda. I am talking about Yavagu. Manda, M-A-N-D-A. Manda. Peya, P-E-Y-A. Peya. Manda, Peya. Vilepi, V-I-L-E-P-I. Vilepi. So there are 3 types of Yavagu. Manda, Peya, Vilepi. Is it clear? Yavagu. Yavagu, 3 types. Manda, Peya, Vilepi. Now, Yusha, 2 types only. 2 types. Akrita Yusha, A-K-R-U-T. Akrita Yusha and Kruta Yusha. Akrita Yusha and Krita Yusha. Very easy, very easy. So, sir, tell me, Yavagu, into bracket, write down rice. The only rice is used for preparation of that product, food product. And in the Yush, it is green gram is used. Mungachi dal, mung ki dal, green gram, mugachi dal Marathi madhi. Yush, like a soup, S-O-U-P. That is soup, okay? Now, what is this rice? Manda, for example, you take 25% rice and 75% water and cook it well. And when only like water is remained, is like a water, you can take a rice very less, 10% rice and 90% water. That is called as a manda. In Peya, nearly 50% rice and 50% water. And Manda and Vilepi, nearly 70% rice and 20% water. It's very soft rice. First is only rice water. In the Manda, Peya, rice plus water. And Vilepi, softer rice. So this is after Vamana, after Virechana, the patient has to take for few days, 2 or 3. Here you can see. Prathamadina, first day, Peya, then Vilepi, Akritayusha, Kritayusha, Akritamausarasa, then Samanya Bhojana, normal diet. So from the day 1 to day 7, slowly from light diet to the normal diet. What is the principle of Sansarjanakrama? After Panchakarma, your Agni is becoming weak. Your digestion becomes weak because lot of stress is there. And then not immediately start normal food. Slowly first light diet and then the normal diet. This is slow that your digestive fire will be stimulated slowly and steadily. This is the principle of Sansarjanakrama. I think that is sufficient for this moment. Now I will go further. Because understanding is important. This you can read in your book. That is already given. No worry. Now I will go here. Okay. Benefits of Sansarjanakrama. I will mark this. This is always asked in the oral. Why it is given? After the Shodhana, Panchakarma, Vamana, Virechana, Basti, Agni of the patient get diminished, weak, W-E-A-K. Sansarjanakrama, dietary advice, strengthens the Agni and patient can get his physical mental strength back. Okay. Now, features of proper Vamana and Virechana. Now, I will mark over here. This is the table. Okay. Now, you have to remember all these terms are very important for Vamana and for Virechana. 4 types of examination during the Vamana. When you give the Vamana, vomiting, induced vomiting, therapeutic vomiting by Madana Phala or licorice, Jeshtamadhacha Kadha, decoction of Jeshtamadha, decoction of Madana Phala. Okay. And Virechana, Trivrut Sneha, Trivrut or Ashwakanchuki, Ichha Bhedi, Naracharas. These are the tablets, name of the tablet. I have explained something sometimes before. So you look also previous videos. Okay. Which test you have to do? Number 1, Vegi Ki. How many? This is Vamana. So how many times this matter is vomited? Big vomiters. Big. And in Virechana, loose motions. 3 times, 4 times, going to the toilet, Virechana. So this is Vega. How many times? Quantity of Vega. Then Maniki, measurement of that expelled fluid. It is taken into bucket. It's not so good, but we are the doctors. So put the mask, and even our attendants, Mama, Maushi, they can measure how much amount has been vomited. About the loose motion, very few times it is done. I am sorry to say, but I have not seen many of the hospitals, they are measuring the Virechana, the fluid, because many of the times it is not possible. Otherwise, he has to take the bucket and take the loose motion in that, but it is not possible. But at least in the Samhita, you should know these words. That's it. In the oral, they will ask you. Vegiki, Maniki is a measurement, that fluid. Antiki, at the end of Vamana, which dosha has been come? After ending of the Virechana, which dosha has been come? Antiki means here cursor my, at the end. And Laingiki, this is the most important. Yes, it is practiced. Symptoms, you have to check the symptoms of proper Vamana, proper Virechana. So in this, I personally feel Laingiki test is the most important. But they will ask you 4 tests: Vegiki, Maniki, Antiki, Laingiki. Vegiki, Maniki, Antiki, Laingiki. Say 10 times. 10 times. Okay. Now here you get, when we say that yes, first class purification, number 1, then you should get patient, not you, not doctor, patient. Patient should get 8 times vomiting and 30 times loose motion. Oh my God, OMG. But yes, they have given. Maybe at that time, in Charak's time, the people are very strong. No? So 8 Vegas and here 30 Vegas. Then Madhyama Shuddhi, moderate purification, 6 Vegas, and our Shuddhi, 4 Vegas. You have to remember all this table. Huh? For me, it is not. In the practice, I don't bother about this too much. Now, this is the very complicated word. You have to search for how much exactly amount. 1 prastha is equal to how much ml? Question mark. Please write down in your notebook. 1 prastha is equal to how much is the amount. If by chance I can get it, I will try to get it for you if possible. I am not sure about it, but okay. Then Sansarjanakrama here. I am just looking for if anybody has given that pramana, man or the pramana. Okay, dosha pramana, prastha. So please write down. Please write down. 1 prastha is equal to approximately 54. Please write down 54 or up to 64 tola, T-O-L-A, tola. Tola. This is also that time measurement. Then you will ask, sir, what is tola? ml. Then 1 tola is equal to 10 ml. Please write down 1 tola is equal to 10 ml. So I am saying that here they are saying 2 prastha. Okay. That means 1 prastha is equal to 64. You do the mathematics, open your calculator. 2 prastha is nearly 128 tola. 128 tola. 1 tola is equal to 10 ml. So that is 1280 ml. 1280 ml. This is 2 prastha. I am not calculating everything. Plus, please write down 1 prastha is equal to 64 tola. Okay. And 1 tola is equal to 10 ml. Okay. I think this is enough. Okay. Then Antiki, when you are doing the Vamana, first cough will come, or rather medicine will come, then cough will come, and lastly Pitta will come. That burning sensation will be here. That is enough Vamana. That is enough Vamana. In the Virechana, first Pitta will come out, and then lastly Kapha will come. This is the difference. Laingiki, Samyak Yoga Lakshana. Symptoms. Lakshana means symptoms. Proper Vamana symptoms. Samyak Yoga, proper. And Asamyak, improper. We are going to see that. What are the Lakshanas of Samyak Yoga? Okay. I think you have understood these 4 tests. Now we will go further. My dear friend, Vamana, Marathi matter is distorted. Kindly excuse. Vamana Samyak Yoga Lakshana. What is funny thing? Lavakshana. Lakshana. Okay. I am not going to read that Sanskrit slok. Forget about that. Sequential expulsion by the vomiting. First, kapha will come out, followed by the pitta, and finally vata. But you have to stop when there is a pitta sensation, burning is here, stop vamana. Doshas are cleaned from the heart, that means chest region, flanks, and head, and sense organs, and a feeling of lightness. Oh, little bit weakness will be there, but my everything which is accumulated as a cough and all this thing, it has been gone out. Cleaning, so much clean feeling in the chest, flanks, head, and nose and ears, everything will be clean by doing the vomiting. So this is Samyak Yoga Lakshana. Sometimes I will try to find out the proper Marathi, or you can just write down from your textbook which you have purchased. Okay. Now, this is Samyak Yoga. Now we will see Hina Yoga. These words are important. I think this is not distorted. This is good. God's sake, this is good. Vamana, correct. Hina Yoga or Ayoga Lakshana. That means, as per expectation, Vaman has not been done. There may be many reasons. For example, patient's Snehan Svedana is not proper. Patient is weak. He is not tolerating the medicine. So there is not proper Vamana. What will be happen? This is correct. Dushchardite Spotaka, Kotha, Kandu, Ruchakha Vishuddhir Guru Gatratacha. I am sorry, I will try to see the translation, that is more important. When there is not proper Vamana, there will be blisters, like a skin problem. You can see skin problem. Oath, papule, swelling, little bit. First is a macule, then papule, then pushul. Pushul is a pus. Papule is a little bit elevation, like blister. Itching will be there all over the body. After 2-5 days, itching will be there. Persistence of vitiated dosha in the heart region, chest region, heaviness will be there, little cough will be there, and a feeling of happiness. So no cleaning has been taken place. That is Hina Yoga. Now we will see Ati Yoga. Woman is not stopping. Oh my God. Dehydration. With Vaman and Virechana, most important Ati Yoga is because of the dehydration. Water is going out. Okay. Trun Moha Murcha. This is correct. No distortion. Anila Kopa Nidra Bala Hanir Vamana. I will read it. Excessive thirst because of the dehydration. Then altered consciousness. Patient becomes drowsy. Doctor, I'm feeling bad. Black in front of the eyes. Very, very weak. This is called as excessive Vamana. Loss of consciousness. You may have to admit the patient in the ICU. Remember, maybe intravenous saline, ringer lactate, you will have to give. Be careful. Be careful. Ati Yoga is not good for the doctor. That is why Panchakarma should not be started immediately when you start your practice. No, my dear friend. You can start massages. That is not a problem. You can start Nasya. That is not a problem. But for Vamana, be careful. If you practice the Vamana treatment in your Ayurveda hospitals, with your seniors, with your teachers, 100 Vamanas if you are given in front of the teacher, then only you start in your practice. Otherwise, don't start immediately, because that can give serious side effects. Okay? Aggravation of Vata, Dhatu Kshayjanya Vata Prakop. Pause. Sir, why you stop? Write down. Vata Prakop always. Two basic causes for the Vata Prakop. Vata Prakop. I have explained already, but in Roganidan, in Swastha, everywhere the same things. Vata Prakop, 2 reasons. Slow and steady. Dhatu Kshayajanya. Dhatu Kshayajanya. Deficiency. Vata Prakop. Second reason. Obstruction. Margavarodhajanya. Srotorodh. Margavarodhajanya. Traffic jam. Vata Prakop. The traffic will be here and there. Traffic jam. Srotorodh. So two reasons are there. Treatment is different. When there is a deficiency, Dhatukshayajanya, nourishment should be given. When Srotorodh, Amapachan treatment is given. Are you getting the difference? Okay, let us start. Then there will be loss of strength, sleeplessness. He can't sleep because of the problem, irritation will be there. Now, we are for Virechana. Proper Virechana, laxative, purgatives, tools are very clear. Heat of the pitta has gone out. Then cleansing of srotas. We are studying the srotas in Roga Nidana, 13 srotasas. Prana, Anna, Udaka, srotas, 3. Rasa, Rakta, Mans, Med, Asti, Manja, Shukra, 7 srotasas. And Mutra, Purisha, Sved, 3 srotasas. Total 13 are important. But how many srotasas in the body? How many? Innumerable. You cannot count. You cannot count. But sir, 13, practically important 13. But in ladies, Artava Srotas, Stanyavaha Srotas, another. Okay? Okay. Cleansing of Srotasas, strengthening the Indriyas, Jnanendriya, Karmendriya, Man. Man is Ubhayendriya. Which are Jnanendriyas? 5 Jnanendriyas. Shrotra, Tvak, Chakshu, Rasana, Ghan. Shrotra, Tvak, Chakshu, Rasana, Ghan, Jnanendriya. Sir, Karmendriya, Vak, Pani, Payu, Vak, Pani, sorry, Pad, legs, Payu. What is Payu? Genitals. Upastha, anal region. Vak, Pani, Pad, Payu, Upastha, Karmendriya. And Ubhendriya is a mind. So everything will be clean. Vyashta. Okay. Feeling of lightness, increased Agni, body becomes disease free, no skin disease, no psoriasis, no acidity, no Rakta Pitta. All for Virechana is Virechana for Pitta. Huh? Okay. Sequential expulsion of feces. First stool will come out, then Pitta will come out, then Kapha, and last Vata. But nobody waits till the Vata has or irritation will be there. Now, I'm sorry. Now we will see about the Ayoga Lakshana. Hina, not proper cleaning. Now, we are expecting for 10, 20 times for stools, but the patient has gone only for 2 or 3 times. What is the problem? Snehana Svedana may not be correct. Proper selection of the medicine is not correct. So there is a less effect. What will happen? Here you can see. I think most of the Marathi Devanagari is clear, no distortion. Aggravation of Kapha, Pitta and Vata. That means their problems will not be sorted out. It will remain as it is. The Agni becomes diminished. Then feeling of heaviness in the body. Then Pratishaya. Running the nose, water from the nose. Pratishaya. Marathi मध्ये आम्ही त्याला सर्दी म्हणतो. इंग्लिश मध्ये you can say cold, C-O-L-D. Pratishaya. Then drowsiness. Not feeling well, I am feeling sleepy. Vomiting. Loss of taste. Vata dosha does not pass in any normal direction. There will be gas in the stomach, not getting flatus, not getting belching. Oh my God, sir, I'm uneasy. Sir, I'm uneasy. Patient will say to you. Okay, so that is Virechana. Now I will go again on the left side, my dear friends. Please allow me. Okay, with your kind permission, let us see. Virechana Atiyoga Lakshana. Virechana Atiyoga Lakshana. Okay, here Vata gets aggravated. Dhatu Kshayajanya Vata Prapop. Lot of water has gone. The Virechana is also loose motion. And if you eat the pani puri and the vada pav on the street food, then what will happen? Sometimes the food poisoning happens and you get the loose motion. That is the disease. That is pathology, bacillary dysentery. But whether bacillary dysentery or whether you are standard Virechana, what will happen? Lot of loose motions and dehydration, loss of water and electrolytes in the body. This is very dangerous. We have to do the saline. Okay. So same like the Vaman and Virechana are very similar. Very similar. You can write here and there both the things. So Vata Prakopa because Dhatukshejanya, loss of Kapha, loss of Rakta, loss of Pitta, then loss of sensation. Patient will not be proper in his consciousness. Generalized body pain, too much pain in the body, fatigue, drowsy, tremors, very weakness, sleeplessness, not sleeping properly, loss of strength, darkness before the eyes, like this. He will fall down, okay, because of the weakness. Hiccup, hicca in Ayurveda, insanity, aswastha, irritation will be there. So this is all about Vamana and Virechana. Now we are going to start Basti. Very interesting for Vata dosha management. And you know, in all the three doshas, Vata dosha is the most important. You know the shlok? Pitta pangu, Kapha pangu, Pangavo maladhatavaha, Vayuna yatra niyante, Tatra varshanti meghavat. Pitta pangu, Kapha pangu, Pangavo maladhatavaha, Vayuna yatra niyante varshanti tatra meghavat. What does it mean? That independent pitta, pitta is always dependent factor. Kapha is also dependent factor. And dhatu and mala, they are also dependent. Only vata is independent. And in the clouds, when the rainy season is there, actually rain occurs where that wind pushes that clouds and then varshanti meghavat. So you can find out this shloka, but very interesting shloka. In this shloka, they have only mentioned that in three doshas, dhatus and mala, which is the most important element in our body? Vata dosha. And that is why Basti is the best treatment for Vata dosha. So Basti is called as, please write down, Basti is called as Ardha Chikitsa. Sir, what is Ardha Chikitsa? Ardha, half. Half. That means it is a 50% weightage in your Shodhana and Shamana Ayurvedic treatment. If you give the Basti, best treatment. Okay, 50% importance to the Basti, not for Vaman, not for Virechana. Basti is important. After Vamana, Virechana, patient is made to adopt dietary regimen, that is Sansarjanakrama, for 7 days. 8th day, he will be given the normal food. From the 9th day, he can again be given Ghrita internally. Do you understand what I have mentioned? Charak is explaining the things as if doctor is giving first Vamana, then Virechana, then Basti. But nowadays, it is not done like that. I have 100 times explained you. Some patients get Vamana, some patients get Virechana, some patients get Basti, but it is not sequentially, all the things are, but they have mentioned at that time. Okay. So, he will be against Snehana Svedana, Anuvasana Basti. You first write down two important types of Basti. Please write down. Very important. Two types of main Basti. One, Anuvasana Basti. ANU. VASAN. ANU. Anuvasana. VASN. Anuvasana Basti. Okay? Is equal to oil enema. Please write down. ORL. Oil enema. Taila Basti. This is first type. Second. Write down second in the notebook. Asthapana. ASTHAPAN. ASTHAPAN. Asthapana Basti. BASTI. In the Kerala, in South India, in some books, instead of BASTI, they have written Vasti. VASTI. In Ayurveda, Basti or Vasti same. Basti or Vasti same. In middle part of the India and north part of the India, we say Basti, BASTI. In south part of the India, Kerala, they said in all their books, all their teachers, all their seminars, Vasti, V-A-S-T-I. Both are same. I think this is clear. So first, Anuvasan Basti, oil enema. Second is Asthapana, A-S-T-H-A-P-A-N. Asthapana Basti. Another name, another. Niruha, N-I-R-U-H-A. Niruha Basti. Asthapana is equal to Niruha, is equal to decoction enema. D-E-C-O-C-T-I-O-N. Decoction enema. Kadha. Quath. Of course, there is oil, but basically kadha plus oil. And in Anuvasan, only oil, no kadha, no paste. I think the difference is clear. Anuvasan, Asthapan. Anuvasan, Asthapan. Main types. There are many types of the Bastis, but these are the main types. It will be asked in the oral. Anuvasan, Asthapan. Okay. Let us move further. So, after the Snehana, oral, ghee or the oil, Anuvasana Basti comes out, food is given to the patient next day in the morning. If Vata is aggravated a lot, then on the second day, again Anuvasan is repeated. If the Vata is less than aggravated, then third day Anuvasan is repeated. And the Pitta and Kapha are aggravated, then fifth day, again Anuvasana is repeated. Every third day of the Niruha Basti, Anuvasan Basti has to be administered. So 1, 2, 3, Niruha, 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 Niruha. Today Niruha, tomorrow Niruha, day after tomorrow Niruha. Then fourth day, Anuvasan. So there is always a trick. Niruha should be followed by Anuvasan because Niruha is little bit stronger, very strong, little bit irritation. And Anuvasan, gentle, soft, giving the relief to your anorectal region. So Asthapana is little bit strong, irritation. Anuvasan is giving the relief, regeneration of the damaged part. Or not damage exactly, but irritated part. Okay. I think you have understood this. Now we'll try to move on the shift on the right. Right, left, right, left. Okay. Okay. Okay, my dear friends, let us see what is there. Okay. Now, can you see here? If there is a kapha problem, kapha dosha problem, kapha dosha prakop, kapha diseases, bronchitis, bronchiectasis, pneumonia, cold and cough, obesity, diabetes, 1 or 3 basti are administered. If it is a pitta problem, hyperacidity, burning, bleeding, 5 to 7 bastis are given. But if it is vata problem, total dryness, musculoskeletal disorders, neurological problems, backache, spondylitis, lumbago, Alzheimer's disease, motor neuron disease, paralysis, 9 to 11 bastis are given. So for vata, maximum bastis are given. Okay. Viramakal, typical word, Ayurvedic word. Viramakal between Niruha and Virechana. After Virechana, Niruha should not be administered before 7 days. I think you are now understanding what I have said. In Charaka, they were thinking that Vamana, then Virechana, then Basti, then Raktamokshana, sequence, sequence, sequence. Nowadays, there is no sequence. Nobody is doing like this. But okay, we have to learn the Samhita. Okay, should not be administered. Some Vaidyas will challenge to my this video. How do you say, sir, we are not following this? Okay, 1 or 2 patients you are following this method. How many patients you have treated? First Vaman, then Virechana, then Basti, then tell me the number. Show me the papers. What I'm saying, in general, it is not done. Exceptionally, anybody can do that. I am not saying Charak is wrong. Okay. Okay. And similarly, after Niruha Basti has been administered, Virechana should not be administered for minimum 7 days. So there should be gap. There should be gap of 7 days. Either you want to give Virechana and then Niruha, or Niruha and then Virechana. 7 days gap is mandatory, compulsory. So don't forget that 7 days. That is called as a Viramakal, pause. In English, it is called as a pause. Now, slowly up. Let me take this point. Contraindications for Bruhana Basti. This is for Bruhan Basti. Please write down this word, Bruhan Basti. This is for Dhatu Kshayjanya Vata Prakopa. Please write down, my friend, Bruhan Basti. See my cursor, see my cursor. Bruhan Basti, nourishing Basti, nourishing for Dhatu Kshayjanya Vata Prakopa. Or another word in Ayurveda, Apatarpanajanya Vyadhi. Apatarpanajanya Vyadhi. Undernourishment problem. Undernourishment problem. Give the Bruhan Basti. If Margavarodhajanya problem, obstruction, ama, srotorodh, then give Niruha Basti. Then give the Niruha Basti. Decoction enema, Kadhyacha Basti. When there is obstruction. So naturally contraindications are opposite. For example, these all the vyadhis, Kushtha, skin diseases. There is a lot of stagnation, kleda, toxins, ama are there. Can you give the Bruhan Basti? No, no. That is for debility. So these are inverse. Bruhan Basti should be given here. Okay. And this will require Niruha Basti. So totally opposite. Can you see like this? That's why Bruhan Basti contraindications are the indications of Niruha Basti. See my sentence. And contraindications of Niruha Basti are indications of Bruhan Basti. I think very clear idea, no problem. So Prameha is Kleda Pradhana Vyadhi. Kleda, K-L-E-D-A. Kleda Pradhana Vyadhi. What is Kleda? Watery waste product developed at the time of watery waste product developed at the time of dhatu pachana vyapar, tissue metabolism. Okay, so in Kushta, in Prameha, in Arochak, tasteless, Tandra, Slipad, filariasis, elephantosis, your legs like elephant, elephantiasis, E-L-E-P-H-A-N, elephantiasis, or same filariasis, F-I-L-A-R-I-S-I-S, filariasis, obese person, medasvi. And we should, where purification has to be done, you cannot use the Bruhan Basti. Bruhan Basti can be given here. Now I am saying contraindication of Niruha Basti. Here we cannot use the Niruha because it is very strong, irritating. Shatakshina, tuberculosis, cancer, very weak, loss of weight, shosh, dhatu shosh. Okay, ati durbalata, very weakness, murcha, giddiness, and mala dosh ashrita vayu prakop is there. Don't give Niruha Basti. You need the nourishment in these cases. Okay. Next topic, Basti Pradhanata. What is the importance of Basti? Vitiated Vata means Vata Prakop. Vitiate other doshas, carries them to the every corner of the body and causes many of the diseases. Basti is the best treatment for normalizing its strong and powerful Vata. When there is strong Vata, I have already used the shlok. Pitta Pangu, Kafa Pangu, Pangavo Maladhatvaha, Vayuna Yatra Niyante Tatra Varshanti Meghavat. See my actions, see my mode. Then you will understand. Okay. Further, sorry. Niruha Basti. Samyak, best. Samyak is the best. Your treatment was best. How you can understand? Adequate and easy expulsion of flatus, Vata. Easy expulsion. Easy feces, defecation will be very good. Easy stools. Urine passage, normal. Micturition, defecation, excellent. Taste of the food increased because cleansing is excellent. All the srotosas are cleaned. Increased agni, digestive fire. Lightness in the various body parts. Cure of the diseases. Dosha and dhatu becoming normal. Samyavastha. And regaining the body's strength. These are the benefits of when your Niruha Basti is excellent treatment. Niruha Basti, Samyak. Samyak means very proper. At the very proper. Okay. Now I will shift my these things over here and try to go a little bit down. Okay. Now here you can see Niruha Basti, Hina Yoga or a yoga. No proper, less effect. Pain in the head because every ama, every toxin, prakupita vata, prakupita kapha, prakupita pitta inside the body. Okay, so headache will be there, cardiac, chest, undone discomfort, anal and bladder region there will be discomfort, pain will be there, swelling over the bladder and genitalia, retention of the urine may be there. Okay, coryza, watering from the nose, cutting pain in the anal canal. Oh my God, sir, very painful. Or anal fissures, anal fissure. It is called as a parikartika. Here another word, but vikartika and parikartika same. The anal fissure, like small ulcers. Okay, excessive salivation because of ama, obstruction to the passage of flatus and urine, and breathlessness because ama is there, srotorodhi is there. So this is not good. Now, next, come on, my dear friend. Niruha Basti Ati Yoga. Niruha Basti Ati Yoga. All signs that are mentioned under the Virechana Ati Yoga. Similar like a dehydration. Okay, you have to read those again. Now we will go oil enema. Anuvasana Basti Samyak Yoga. Can you see here? The administration of Taila Basti, carries along with its fecal matter from the rectum. Best. Samyak is always best. And flows out without any difficulty. Good defecation, good micturition, strengthening of Rakta Dhatu, Buddhi and Indriya, everything fantastic. Sound sleep, lightness in the body, improve the strength. The Mala Mutra pass out without creating discomfort at the right time. I think everything fine and fit. I think this is very common in Vamana, Virechana, Basti. So if you remember one thing when understanding proper, then anything you can write. Anything you can write. Okay. Now we will see Anuvasana Basti, Hina Yoga, but on the right side of this page. So let us go slowly up. Slowly up. Okay. Anuvasana Basti, Ayoga. What is Ayoga again? Ama remains there, vata, pitta, kapha, bad things remain in the body. So problem. Pain in the, always pain will be there because of the problem. Everything is inside, na? West, everything is inside, not going out. Pain in the region below the umbilicus, abdomen, arms, flanks and back, everywhere paining. Body becomes unctuous because oil enema is there. Obstruction to the passage of flatus, defecation, and urine micturiation, problematic, problem, because improper, not correct treatment. Now, what is next? Ati Yoga. Can you see? Ati Yoga. Ati Yoga, nausea. Altered consciousness, drowsiness, because of the excessive is there, weakness will be there. Exhaustion, in spite of not doing the work. Body will be exhausted. Body ache will be there, loss of consciousness, cutting pain in the anal region and anal fissure, that is vikartika. When the sneha given through Anuvasan stays in the body for 3 yama and then passes out along with the waste products, the body is said to be clean properly. Okay, so you have to find out the time factor, 3 yama, how much time is there. Now, Karma, Kal and Yoga Basti, it is always asked for the SAQ 5 marks. Please write down, this is the note. Karma Basti, separate. Kala Basti and Yoga Basti. 3 types of the Basti. Karma Basti, Kala Basti, Yoga Basti. That is a combination of Anuvasan and Asthapan everywhere. Combination, Anuvasan plus Asthapan. Anuvasan plus Asthapan. Karma Basti, Kala Basti, Yoga Basti. Only the number is different and the sequence is different. Number and sequence is change of Anuvasan and Asthapan. Number and sequence is change of Anuvasan and Asthapan. Karma Basti, Kala Basti, Yoga Basti. Now, Karma Basti 30 number. Remember the number. Kala Basti 16, Yoga Basti 8. Karma Basti 30, Kala Basti 16, Yoga Basti 8. Please remember these numbers. And now the sequence. That is 1 Anuvasan, 12 Niruha, 12 Niruha, and 5 Anuvasana. Okay? 12 Anuvasan, sorry, here 1 Anuvasan, 12 Anuvasan, and 12 Niruha alternately. That means today Anuvasan, next day Niruha. Anuvasan, Niruha. Anuvasan, Niruha alternately. That is 12 times. Okay? Then 5 times Anuvasan, the last 5 times. So this is 1 plus this is 24 plus this 5. Total will be 30. Kalabasti, 1 Anuvasan, 6 Anuvasan, and 6 Niruha alternately. Okay? And 3 Anuvasan, last 3 Anuvasan. Yogabasti, 1 Anuvasan, 3 Anuvasan, 3 Niruha alternately, and 1 Anuvasan at the last. Okay? So this is all about the Basti. Now again, I will have to shift on the left side of the page. Okay, just wait. Bear with me. Thank you very much. Okay, my dear friends, this is the last page of today's lecture. Happy. Okay, Shiro Virechana, Shiro Virechana, Shiro Virechana, Shiro Virechana. Very simple. Shiro Virechana, please write down, is a synonym, paryay shabda of Nasya. Shiro Virechana means Nasya. Shiro Virechana is equal to Nasya. Shiro Virechana is equal to Nasya, nasal drops. Okay? Shiro Virechana or Nasya Karma is advised in a person whose body has become cleaned by Vamana, Virechana, Niruha, and Anuvasana. Again, you remember from the first point of the lecture, I am saying that in Charak's time, they have the sequence Vamana, Virechana, Basti, Rakta, Moksha, and Nas. Similarly. But nowadays, some people are given Vaman, some people Virechan, some Basti, some Nastya, like that. Okay? No problem. Shiro Virechana, first is a Samyak Yoga. Just bear with me. Okay? Lightness here. Samyak is the best. Samyak is always best, number 1. Everywhere lightness in the head and chest, organs, all nose, ear, eyes functioning well, body, all the sutosas become cleaned. This is the benefit. Now next, Shiro Virechan Ayoga Lakshana. Not proper. Some problem is there. So coating in the throat, tongue will be coated because no cleansing, coating will be there. Heaviness in the head and increased salivation, bodhaka kapha, lot of secretions. Agrimandya, ajirana, apachana. So all these are ayoga, not cleaning. Cleaning is not properly. So ama is there, dosha west, debris is there. So these are problems. And next is atyoga irritation. Here not dehydration. Actually, here you is not a concern with the water loss. In Vamana Virechana, water loss. But here, problem in the region. Pricking pain in the head. Lot of irritation. Eyes, temple region, ears, and darkness in front of the eyes. Oh, sir, doctor, I'm getting giddiness. So there will be irritation. So Shiro Virechana, Atiyoga Lakshana. And next point is Parihara Kala. Will you please write down this word Parihara Kala? After the Panchakarma, maybe after Vaman, maybe after Virechan, maybe after Basti, maybe after Nastya, Pathya has to be followed for a period twice that of the number of days required for procedure. Are you getting my point? I will explain. Please write down. Parihar Kal important. How many days one should take care? How many days after Panchakarma one should take care? For example, Snehana is given for 5 days. Okay? Maybe 3 days, 5 days, or 7 days. I think the student's video has been lost. He may join soon. Okay? Yes. Okay, back. Pariharakal. I am explaining Pariharakal. So, patient always asks, sir, how many days you are all the pathya I should follow? The answer is, for example, Vamana. You give the Purva Karma, Snehana Svedana for 5 days. Then you give the 6th or 7th day Vamana, okay? And then next 7 days, Sansarjanakrama, you remember? Dietary advice, Mandapeya, Vilepi, Yavagu, and Yusha, etc. So total near about 15 days, okay? Here what they have mentioned, then he has to follow next 15 days all the pachas. So totally 1 month, he will have to be very cautious about his food and about his lifestyle. So total pathya should be followed minimum for the days. Here they have mentioned twice that of the number of days required for the procedure. I have required Vamana procedure total, Purva Karma, Pradhana Karma, Pashtat Karma, I require, say example, 12 days. Then multiply by 2, that is 24 days. So what will be the Parihara Kala for Vamana patient? 24 days approximate. It depends how many days you give for that Karma Basti, Kala Basti, Yoga Basti, how many days? 30 days program. And then Sansarjanakrama for 7 days. So around about 35 days. So again, multiply by 2, 70 days he will have to be careful while taking the food and lifestyle. So this is called as a Pariharikal, that is twice the number of days required for the procedure. My dear friends, as this is a 4.02, that is 4 in the afternoon and 2 minutes. So this is the time to quit, and we will meet on the Monday, that is tomorrow, in the 7 p.m. with the Roga Nidan classes. Thank you very much. I wish all the best. Take care and good evening.